Greetings, health and human enthusiasts, and welcome to the Regaining Health and Humanity podcast. I'm your trusted guide, Dr. Scott Johnson, and I'm both humbled and thrilled that you've chosen to join me on this fearless pursuit of knowledge and inspiration. My mission is to elevate your well-being naturally, arming you with evidence-based insights, revolutionary breakthroughs, and impactful health tactics. But that's not all. Together, we'll dive deep into the mysterious realms of human existence, unraveling the secrets of what makes us truly thrive. This podcast isn't just about information. It's a catalyst for change. Join me in confidently exploring potent natural solutions, cutting-edge health strategies, and igniting courageous conversations that cultivate meaningful connections and foster empathy for humankind. I'm here to empower you to unleash your extraordinary potential and lead a life jam-packed with boundless health and happiness. So get ready. Your extraordinary journey to boundless health and happiness starts now. Hello, friends. I'm so excited for today's podcast because we have a highly accomplished woman and health professional that is going to share strategies for women to smoothly transition between life's stages. Dr. Ashley Anderson has both a Bachelor and Master of Science in Nursing and a Doctor of Philosophy in Nursing. She also received a Women's Health Nurse Practitioner specialty and a certificate in health professionals education. Dr. Anderson is the founder and CEO of Athena Health and Wellness, a women's health practice that is the first of its kind in Louisville, Kentucky. And one thing I love is that she uses natural remedies in her practice, including essential oils. Beyond her significant accomplishments in healthcare and dedication to women's healthcare in particular, she is a well-rounded and achieved a lot in her life at such a young age. She is an author, community activist, actress, radio personality, motivational speaker, and international runway model. Dr. Anderson participated in beauty pageants to take advantage of additional scholarship opportunities as she pursued her education. She's been crowned Miss Black Ohio 2010, Miss Kentucky US 2013, and Miss University of Louisville. I'm not done yet. She is also a collegiate basketball player and team captain, was named Glamour Magazine Phenomenal Woman of the Year for Kentucky in 2014, and empowers young Black women to develop leadership skills, confidence, and network to achieve their biggest goal in life as the executive director of the Miss Black Kentucky USA Scholarship Organization. To top it all off, she is the mother of 2 boys, so pay attention. You are bound to learn a lot from Dr. Anderson. Welcome, Dr. Anderson. It is an honor to have you on the Regaining Health and Humanity podcast.
Thank you. Thank you for having me. I'm totally honored to be here. But I just want to take a moment of silence for, I just turned 40. So for you to say at such a young age, I'm just basking in that right now.
Yeah, there you go. Age is just a number, right? It's how young you feel and how young your cells are functioning, right?
Yes, yes. And we're working on that every day.
Yeah. Well, let's start by talking about doctors of nursing, because I don't think many people understand that nurses can achieve a doctorate degree. A doctorate really is the highest level of education available in the field of nursing. What additional or different training did you receive as a doctor of philosophy in nursing, and how do you think this helps you in your practice?
Sure. So There are two different terminal degrees in nursing. So the PhD, which is what I did, and then there's a DNP, which is deemed
Hmm.
more of a practice-based terminal degree. So the PhD I did on the once I completed my master's degree, I worked for a couple of years as a nurse practitioner, and I got this wild hair to learn about research and be able to perform studies and write, because I love to write anyway. And so basically, I went full time. So, full time, the program was 2 years of coursework, studying all different types of research, statistics. We learned qualitative, quantitative methods, learned a lot of different um, lots of classes over the
Yeah.
course of 2 years. And then we have to complete a full dissertation study. So I chose to study self efficacy, contraceptive self efficacy in teenage girls.
Oh.
So I did a mixed method study where I had a survey that was a contraceptive self efficacy study that I had young girls complete that were coming into a local family planning clinic, and
Hmm.
there was a certain number I had to do for statistical significance. And then I did interviews. I believe there were 12 interviews, and I basically interviewed these young women to find out different personality traits or characteristics of them that made them successful birth control users. Ultimately, trying to determine if there were any similarities that similarities that could be taught, so it's like, okay, if we know girls that have high self-confidence tend to be successful using birth control and like demanding condom use and sexual acts and those types of things, how do we
Hmm.
teach young girls to have self-confidence so that it crosses
Right.
over into that area? So it was a really interesting study. It was a lot of fun. It took a long time. The
I
writing
can imagine.
process took a long time. When I started the project or started the doctorate degree, at orientation, the dean came in and was like, 50% of people that complete their coursework never get their PhD. And I was appalled. Like, how do you spend
Mm.
2 years of your life studying this stuff and then just quit? And I'm like, how many emails did I end up writing to my chair? Like, you know what? I can't do this anymore. I
Yeah.
think I'm done. But I think the dissertation process, start to finish, it took me a total of 3 years. So I think it was a 5 year process from beginning coursework to actually completion.
Yeah, I love some of the concept of what you're saying is, people are not defined by their illness or their condition. And if we look at them more holistically and as a person, then we can definitely have a better outcome when they participate in the healthcare system. Women, particularly, they go through several stages of life that causes fluctuations in hormones. Yeah. How does lifestyle influence the ease at which women might transition through these stages?
Because a lot of the things that we are consuming as a food source also cause inflammation. We're talking about like dairy, sugar, caffeine. Those types of things tend to make symptoms worse. So and we're even looking at this inflammation piece. We're also not even talking about how much those inflammatory agents cause our hormones to be more out of balance, which long term, it just means the symptoms get worse and worse. But lifestyle factors are huge, because I was having a conversation with one of my patients yesterday, actually, because we're talking about like Black women and how so many things we say are hereditary, when I think that we pass down bad traditions that ultimately lead to the same results. And so I think we have to get really intentional about literally what we're putting in and on our bodies, because as we transition hormonally through different stages of life, those things will come up to haunt us. But, you know, culture has taught us that those symptoms are normal, and they're
Hmm.
not. Mm-hmm.
Right, particularly when it comes to women's health. I think it was
Hmm.
an oft ignored the symptoms, and that becomes problematic because then
Hmm.
people think, well, I this is the way it is, and I can't do
Hmm.
anything about it. When there are solutions, so I'm glad that you're championing these solutions for women.
Hmm.
Let's get into another thing that I think is a big problem, and it's a growing issue. And I think it's related somewhat to the toxins you're talking about because of the
Hmm.
endocrine disruption that they can trigger. But
Yes.
menstrual pain is reported by nearly 85% of women, with 43.1% reporting pain occurs every single period that they have.
Hmm.
Having three daughters and a wife myself, I'm particularly interested in your
You're
approach to help ease
surrounded.
these cramps. What is your approach when a young woman comes in with painful menstruation?
Yeah, so I have a preferred way and a least preferred way. So, what we know about menstrual pain, it is not normal. Culturally, everyone expects, oh, when you have your menstrual cycle, you're going to have pain. No, the pain is actually a sign of a hormonal imbalance. So
Mm-hmm.
that means we need to do some hormone balancing work. So a lot of times patients come in and they're just like, put me on birth control pill or something like that, because in most cases that'll fix the problem. But it's truly a masking, right? It's like, we know that you can go on that, you might have some good cycles for a while. When you come off of it, we're going to be back in the same boat.
Mm-hmm.
So that is like my least preferred way, because I'm all about root cause. Like, let's get to the root of it, fix the root, and then decide if you want to do something different. But the way that I recommend managing that is through a lot of oils. I mean, the lifestyle piece is always like foundational. So working on
Yep.
removing those endocrine disruptors from your life, especially the week before your cycle.
Mm-hmm.
So, I mean, you can get a little crazy in week 1, week 2. When we hit week 3, prior to, that premenstrual week, it's really important to kind of scale back, which is hard for women because that's typically the time that we're craving when that estrogen level starts to drop. It's like we're wanting sugar, we want the caffeine, we want all the salt, and those are absolutely the worst things for you. I'm going to
Mm-hmm.
tell you like a little study I did on myself before pregnancy, so I'm
Uh-huh.
going to come back to that. But
Okay.
um the obviously getting those inflammatory agents out of there, but things like clary sage I love for hormone balancing. I love copaiba. It's an incredible anti-inflammatory agent that I recommend as an everyday use, and
Mm-hmm.
turmeric too, because I think if you're on a regular basis working on anti-inflammatory, like decreasing inflammation in your body, when you get to your cycle, it's naturally going to be less painful. Even cinnamon is one of my favorites. I remember even like buying cinnamon in capsules out of Kroger before I even knew about essential oils. And
Yeah.
that was like, a replacement for taking a over the counter medication or something. But those are some of my favorite things. And I love using cypress to help with decreasing the flow, because sometimes when women have or painful periods, they also have heavy periods, and the
Mm-hmm.
cypress across the abdomen is like magic for decreasing that. Um, so the little study I did on myself, I was reading. Shout out to Stephanie Fritz, her book "Essential Oils in Pregnancy, Birth, and Babies,"
Mm-hmm.
and she talks about her pregnant patients who would go without sugar for their whole pregnancy, and how they, first of all, I thought that was like wild and mind-blowing, because in my mind pregnant women always want sweets and like foods and those
Mm-hmm.
types of things. But she said that they bled less during labor, they had less painful um, contractions, and they tore less during the birthing process. And so, of course, me thinking, like, is that real life? Like, let me see. So I did an entire month of no concentrated, no sugars, only fruits.
Yeah.
And my cycle was amazing. Like, I didn't have any pain, I didn't have any crazy moods. And then this was actually, I remember this because it was the end of October going to November. So I made my month, I did the month, I was like, that was great. Then Thanksgiving happened. My birthday is December 2nd, so the next week. So I was like sweets, cakes, pies, ice cream, all the things. The cycle I had in December was mind-boggling. It was
Mm.
horrible. And then I tried one time where I was on my cycle having no pain, and I love Swedish fish. So I had a Swedish fish. Within 10 minutes, I was cramping. So it's
Mm.
like those things, they really, really matter, those lifestyle things, especially the sugars, the caffeines and stuff. They're so helpful to remove those things from your life, especially premenstrual.
Yeah, that makes sense because those are inflammatory foods. Sugar
Mm-hmm.
is, and it's probably contributing to the prostaglandin level
Yeah.
spiking,
Oh,
and
yeah.
those are critical for menstrual cramps to be. I mean, if the more higher prostaglandins means worse menstrual cramps for sure.
Mm-hmm.
So,
Yeah.
another thing that I see frequently is urinary tract infections, which are
Mm-hmm.
more common among women, primarily due to the anatomy of the female lower urinary
Mm-hmm.
anatomy, and also its proximity to reproductive organs. Short female urethra gives bacteria a shorter distance to enter the urinary tract and cause an infection. What
Mm-hmm.
strategies can you share to help women reduce the frequency and the severity of UTIs?
Yeah, so there's a few things. Like you said, anatomically, we're kind of like give him the short stick right there. But I think increasing water intake is huge. I know for a long time it was the 64 ounces a day. Now I recommend at least 100 ounces a day or half your body weight.
Mm-hmm.
I definitely recommend adding citrus oils to your water because obviously the detoxification gently of the kidneys is very helpful. And then some lifestyle things like not holding your urine, so important. Just go. I see that a lot with my teachers because they're like, I don't have anyone to help me like come in and watch my class, so I can go to the bathroom. So they hold it for 4 hours,
Yeah.
and then they're just constantly in this loop. Urinating after sexual activity, I think, is
Mm-hmm.
is a very, very good practice. And then surprisingly, I feel like people don't teach this anymore, but making sure you're wiping front to back, like that's really, really important as well.
Absolutely.
Yeah, so I think those basic things really help a lot with UTIs. And then even, adding in like cranberry juice, cranberry pills, whatever, is the easiest way for you to get it down. But especially if you know that you're more prone to getting a urinary tract infection, doing that as a consistent kind of preventative measure is really helpful. And even probiotics, I've definitely found
Mm-hmm.
that women taking probiotics are less likely to develop UTIs too.
Yeah, I think you and I are very aligned on the approaches, both lifestyle and some of the oils and supplements. I'd say the only thing I add addition to that is probably
Mm-hmm.
D-mannose powder. I really like
Mm,
that as another option for women who get frequent UTIs. I found that very helpful.
yeah, let me put
One
that on my
thing that
list.
is, yeah, add it to the protocol. One thing that is commonly reported among mothers after childbirth is urinary incontinence.
Hmm.
A cough, a sneeze, or certain movements during exercise may
A
cause
laugh.
the involuntary, release of urine. And that's
Yeah.
obviously embarrassing and it's not something they want to deal with. So during pregnancy and after childbirth, hormonal and anatomical changes to the pelvic floor muscles that support the bladder occur, and they contribute to this. What have you found that can help mothers or others experiencing urinary incontinence?
Hmm. One of the things that I was introduced to about maybe 7 years ago is the pelvic floor physical therapy. I didn't even
Mm-hmm.
realize that was a thing, but
Yep.
it is so helpful for women. I actually did it myself, like during and after both pregnancies,
Mm-hmm.
and it was extremely helpful. I think that's a pregnancy, and the symptoms during and thereafter is another part culturally that we kind of chalk up to, oh, I pee a little when I cough or sneeze or whatever, and that's just kind of the way it's going to be. No, we
Yeah.
can fix that most of the time.
Mm-hmm.
So there are a lot of pelvic floor physical therapies that are really great. It doesn't always tell women, it doesn't always mean that you have to have internal work done. Because I think when people hear that pelvic floor PT, they're like, wait, that is way too invasive.
Right.
But it doesn't have to be that. But I think it's really it's a great thing to do. If you don't do it, if you don't need it during pregnancy for like low back pain and stuff, but doing it on the other side of birth, because just of the body trauma that we don't always talk about, like obviously the lower back pain when you're holding and hunching over with a baby, so you end up with lower back or upper back pain, shoulder pain. I developed this some kind of synovitis in my thumb. They call it mommy thumb from
Hmm.
like the way I was holding my son's bottom. It was a whole thing. I almost like dropped him one time. Like, so it's nice to be able to assess even the diastasis, different body traumas that, you know, we can fix. You don't have to have like a V-tinted belly forever. So you can do it right after pregnancy, or if you're someone that's like, my kids are 15 or 20, I'm having these issues, it's not too late to start that. So I would definitely recommend doing some physical therapy.
Yeah, I love that because that's really going to what you said, the root cause. You know, these
Mm-hmm.
pelvic floor muscles are what support the bladder, and if you don't have good strength and tone in those, then that's when that urinary incontinence happens. And I
Mm-hmm.
think all too often when somebody goes to just their traditional MD, one of the first things they do is they consider a surgery to fix that. And
Mm-hmm.
I've just heard horror stories from people who have gone through that surgery. And so anytime we can do this in a more natural approach, it's great. And I just will mention real quickly that you actually can now get FDA approved devices that you can use at home that are made to stimulate and strengthen the pelvic floor. And so it's an electronic device that's inserted, and you do that twice a day for 30 minutes. And I've seen some good success for that with women as well. So that's another option.
You're gonna have to drop a link to that.
Yeah, I will. I'll have
Yes.
to put that in this podcast so people can find that, because
Yeah.
I think that they work really well and even when people have tried the pelvic floor exercises and maybe not had the success they want,
Mm-hmm.
this actually stimulates those pelvic floor muscles in a different way.
Mm-hmm.
And our muscles fire with electricity, and so it's using these electrical impulses to fire those muscles. And so it can not only improve urinary incontinence, but it can also improve sexual satisfaction. So I think
Mm.
it's a worthy thing to consider.
Yeah, and you know, I was even thinking when you were speaking, especially, you know, for women whose insurance may not cover the physical therapy, or maybe it goes to their deductible and it's cost prohibitive, that would be a really great option for women to
Yeah.
use at home.
Hmm.
Yeah, I love that.
Okay, next question. Sometime in their 40s, women
Mhm.
begin a transition called perimenopause, which
Ah.
means literally around menopause. That's what that means. But
Hmm.
changes in hormones during this time can lead to irregular periods, hot flashes, vaginal dryness, mood changes, and more. Western medicine attacks these uncomfortable symptoms with hormone replacement therapy using synthetic hormones. However, the risks of this make some women want to seek alternative options. Can you share some of the risks of synthetic hormone replacement therapy?
Hmm. So I always share that when we're talking about adding synthetic hormones to fix a problem, like I mentioned, even with the menstrual cycle
Mm-hmm.
pain, it's a band-aid. And at some point you will go off of the estrogen or whatever that they're putting you on, and those symptoms will recur. So you're basically just kind of prolonging it, and it'll hit you at some point.
Mm-hmm.
So that's one thing I always like, just know that it's a band-aid. It's not it's not the fix.
Yep.
You know, with synthetic hormone replacement therapy, it's like you're putting something in your body that was not made by your body, or something natural that it recognizes as such. So there's always potential side effects with that. And then, I mean, there's blood clots, there's potential for different types of cancer that can develop,
Mm-hmm.
stroke, heart disease, and then there's even more risk for those things if you have different lifestyle factors. So if you're a smoker, if you've had any issues with like blood clots in your entire life, those are like contraindications. So, you know, did I say heart disease? I don't know if I said that or not, but it's just,
Hmm.
in my opinion, it's just not worth the risk.
Right. So
Mhm.
instead of using synthetic hormone replacement therapy, how do you help your female patients during perimenopause?
Yeah. So, one big thing that I am an advocate for is therapy. So, we're going to talk about, I mean, obviously we can focus on the diet, the inflammatory factors that we talked about
Hmm.
already, but I have found that perimenopause kind of triggers something in women, that
Mm.
things are no longer what they were. When we start thinking about, oh my gosh, this means that I'll never be able to have children again, even though they may have closed that fertility window for themselves years ago. It's the fact that you
Hmm.
can't, that becomes a thing. And then, bodies changing, things aren't what they used to be, maybe dealing with vaginal dryness, issues with sex, like all of those things are an issue. And then, like you mentioned, mood things. I have a patient who is a therapist that said she was going to petition to add perimenopause to the DSM-4 or 5 or whatever number it is now, just as a
Yeah.
psychiatric condition, because of
Hmm.
all of the things that women experience that can ultimately feel like they're driving themselves crazy. But yeah, so that was a whole like thing. But therapy, I think, is very, very important, just because change is hard, transition is hard, especially
Hmm.
when it feels out of your control. So therapy is a big piece, focusing on diet, trying to eat more clean, making sure you're getting good exercise and the physical activity is so important. Your hydration is so important, again, because it's going to just help with minimizing symptoms. And then using some oils. I love peppermint oil for those hot flashes, applying that. You can put it in a spray bottle with some distilled water and just spray away, just to
Hmm.
do that, and across your forehead, behind your ears. Clary sage, I think, is another one that we mentioned already. I love lavender for menopausal symptoms, especially mood. Balancing thyme and orange, I also love too, because I just feel like it helps to relax the body and the mind. So copaiba is another one that I really like, and
Hmm.
cedarwood, just to relax and ground the body during that time. So those are some of my favorites that I like to use during, and fennel
Oh,
and,
yeah.
and, and lavender and clary sage together. That's one of my favorite combos, just to apply a couple times a day in a consistent manner to just kind of keep things at bay. And then specifically in the diet part, kind of staying away from spicy foods and hot foods are really
Mm.
important for women who are really suffering with the hot flashes.
Yeah, makes total sense, and I'm glad you brought up therapy because that's one thing I'd like to see a cultural shift in, is
Mhm.
a taking away the stigma of therapy. Everybody needs
Yeah,
help, and everybody should
everybody.
see a therapist. I'm
Hmm.
a big believer in that, and so I'm glad you mentioned that part of it.
Yeah, I
Now, the
tell my
next,
patients, just like we all have like our hair girl and our nail girl, like we need a
yeah,
brain girl. If
right.
you're a person, it doesn't matter what their gender is, but as long as you, even when things feel good, it's so important to consistently be monitoring and managing your mental health.
Yeah. So the next stage of life is menopause. This stage usually occurs during a woman's 40s or 50s and marks
Hmm.
the end of regular menstruation. But it may trigger chills, hot flashes, night sweats, loss of libido, thinning of the hair and skin, slowed metabolism, vaginal dryness, loss of breast fullness, just to name a few of the
Just
symptoms
a
that might
few.
occur. But what are some natural options that you have found effective for menopausal symptom relief?
Really all the stuff that we just talked about, like all of those, I recommend them equally during
Hmm.
menopause and perimenopause. Basil, I do like a lot. I think, for one of the main symptoms I hear from women in the menopausal season of life is brain fog. and having issues with alertness and being able to focus. And basil is one that I really like, the smell of that one, and rosemary too. um I feel like, yeah, everything else would be the same. I think it'd be like a good regimen to put yourself on during that, actually before perimenopause, and
Mm-hmm.
just
Yeah.
consistently carry on, because I feel like you're setting yourself up to transition a lot easier with a lot less symptoms.
Yeah, I agree. And when you're talking about all these oils, I know some of them you mentioned applying topically,
Hmm.
and some being diffused. Are you ingesting any of these as
Hmm.
part of the protocol?
Yeah, I love ingesting copaiba for sure, turmeric for sure. When we're talking about inflammation and pain, um,
Mm-hmm.
to take internally. Clary sage, I like internal as well as topically.
Mm-hmm.
I love the smell of clary sage. I know it's not everybody's jam, but the
Yeah.
clary sage, fennel, and lavender rolling, or putting that on like perfume. I like that topically, but all of those you could take internally as well to get you even better benefits. A peppermint, you can definitely, I like, in addition to spraying on the peppermint for hot flashes, putting a drop under your tongue,
Mm-hmm.
also amazing. We had actually had a patient yesterday who was in the middle of filling out her paperwork, and she just like stopped and started like fanning herself. She's like, I'm having a flash. And we're like, no worries. So we just brought her some peppermint, had put a drop or two under your tongue. Let's rub some up your spine, behind your ears. And she was like, I need that. I need that in my
Yeah.
life.
Yeah, and I'm sure a lot of people, a lot of women listening to this are saying the exact same thing. I need more peppermint in my life.
Yeah.
Um, Sexual desire and function can decrease as hormones change as well. So, what are your recommendations for women who experience this?
You know, the first part, when we're talking about libido, is figuring out the root of it. So yeah, it could definitely be hormonal, right? But I find, when women, this is like something I say with my patients, so don't be offended when I say this. Say, one of the big, especially when we're talking about heterosexual relationships, like women's desire and ability to, are, want to perform is very different from men's. I say all the time, like,
Mm-hmm.
men,
Yep.
if the wind blows right, they're like, woo, let's do it. Women are like, you
Mm-hmm.
got on my nerves last week, I had a stressful day, like the kids, this and this, I don't want to. And
Yep.
so sometimes there's a root, like it is a problematic thing that we need to balance some hormones, or do something like that, add in some sort of like aphrodisiac or stimulant or something like that to help. Sometimes there's lifestyle things that we need to work on, like, is it stress related? Is your job or lifestyle really stressful for you, that we need to manage stress and do some things there? Are you getting enough sleep? Are you just exhausted and you just cannot turn it on, right? So I think really trying to figure out the root of it. And if we're like, well, I'm eating well, I'm exercising, I'm doing all the things, but the desire and drive is just not there, I think it is probably, um, you know, hormonal, or whatever. Ylang ylang is one of my number
Mm-hmm.
ones. Like, it is my favorite. I feel like it works like a charm. You can apply that topically. I call them the perfume points. So wrists behind your ears, over your heart, bottoms of the feet as well. Clary sage, you can use. Some have a preference. I think using them together is even more powerful. I normally tell women, if you apply it topically and you're not getting the feeling that you want to get, put a drop or two of each under your tongue, and it's going to be fun. And if you want to, go ahead and get it diffusing. I'm like, if you know you're going on a date with your partner, go ahead and put it on like perfume that morning when you're getting dressed, reapply
Right.
it midday, and just allow yourself to, get into that space. But diffusing it, wearing it topically, and then using it internally is great. I also love cinnamon for
Hmm.
women. It's very warming. Even just using it with a carrier oil on the bottom of your feet is very warming to the body. And then the other part to sexual desire and function that I see with women is mental, in the sense that we're thinking too much,
For
or we're
sure.
thinking about our laundry list of other things and just like cannot turn it off to be present. So in that case, I recommend vetiver on the big toe, bottom of the big toe, that reflexology point for the brain, just to shut it off.
Mm-hmm.
Taking the copaiba internally also, I think, does the same thing. Any of the grounding oils, frankincense is another really good one, just to allow you to get grounded and be present and be in the moment. So those are my favorites.
Yeah, I can put a second to those. Those are all great options. If it's been 12 months since their last menstrual period, a woman is considered in postmenopause, which is the
Mhm.
next kind of life stage. Unfortunately, postmenopause can include some of the same symptoms that you
Mhm.
experience during menopause and perimenopause, but you also can have an increased risk of osteoporosis.
Mhm.
So, do we could just continue? Do women just continue with the same recommendations you've made for perimenopause and postmenopause, or do you do anything different or add anything for postmenopause?
Yeah, I think most of them are the same. I kind
Mm-hmm.
of, when I was thinking about this question, was like, exercise is so extremely important. Cardiovascular, yes, because as we age, obviously we want to make sure our heart health is optimal, but
Mm-hmm.
that is so important to add in that weight bearing exercise as well.
Yep.
To just make sure that we're doing as much as we can to support our bones. So that is one thing. If you're a smoker, got to cut it out. Like any of those things that we know that can cause issues with our bone mass or bone density, we've got to cut that out. Supplementation is really huge. This is not a time where we can just be okay with being vitamin D deficient or calcium deficient. So making sure that you're taking a plant-based supplement that your body is absorbing the nutrients and able to actually use it would be very, very important. Weight control, so managing what you're eating, your water intake, focusing on that toxin-free living, like we've talked about throughout, I think is very important. And doing your consistent checkups and screenings is one of the big things too, because it's very easy to get caught up in life and transition and all the things that are happening and just not go get your mammogram. I had my first mammogram today. I was not excited. Like the lady came out to get me and was like, "How are you?" I'm like, "Great. Could have thought of a million of other places to be than here."
Most
But we've
exciting
got,
thing in your day.
yeah, I just couldn't wait. I turned 40 in December. It took me a couple months to make myself go do it, but we have to do it, right? And none of them are fun. And I think we're in that postmenopausal phase, we should be getting bone mineral density tests. So the DEXA scan every couple of years, especially if you have a family history of osteoporosis or osteopenia, that's important. Getting your blood work done annually, like all of those, preventative screenings are so extremely important. And if you've got issues, any chronic health ailments or new ailments or whatever, make sure you stay on top of those. Because as we age, it's like I always tell people, it's like, okay, you get older, we age, it's a blessing, life's not over, but we just have to be a bit more intentional about making sure that we manage our health and wellness, because we only get one of these bodies.
That's right. Got to take care of the one you get.
Yeah.
Well, thank you so much for being on the podcast, Dr. Anderson. I'm sure that
Mm-hmm.
you have empowered many listeners and women with strategies they can implement today to improve their life. And so, on their behalf, I will say thank you.
Mm-hmm. Thank you for having me. This was an honor.
Thank you for investing your precious time with us today. I trust you've uncovered valuable insights to elevate your health and enhance your quality of life. If you're hungry for more evidence-based wisdom to transform your well-being, I invite you to check out my 20-plus books, all waiting to be explored on my website, authorscott.com. Don't miss out on the chance to supercharge your knowledge. Please share, like, and subscribe to be part of the movement revolutionizing lives. In a world drowning in noise and endless information, your share can be the beacon that guides others to a better life. Together, let's make a difference by amplifying the life-changing knowledge you've gained today. Until next time, here's to your journey to boundless health and unbridled happiness.